Group 3 is covering the Veterans Affairs scandal specifically concerning culture and ethics, as well as clinical performance. Group 3's members are Katie Bowling, Brian Frey, Christopher Harris, Everett Holmes, Jennifer McCourt, and Holly Villanueva. This is for Managing Healthcare Organizations, Dr. William Kaiser, Spring 1, 21 February 2017. This presentation is going to cover the abstract, the synopsis of the scandal, issues that were leading to the scandal, how to overcome adversity, and what it will take to define success in the future. The Department of Veterans Affairs was officially founded in July of 1930. President Hoover signed an executive order in which the Veterans Bureau was put at a federal administration level. The intent was to consolidate and coordinate government activities affecting war veterans. The Department of Veterans Affairs has 5 core values that are pertinent to their mission. These include integrity, commitment, advocacy, respect, and excellence. These core values are what they use to reflect the service that they provide to veterans. President Barack Obama appointed Eric Shinseki as the Secretary of the Department of Veterans Affairs in January of 2009. At this time, the VA had a huge backlog of veterans waiting for basic care that they required. Secretary Shinseki decided to create incentives to improve the VA care and efficiency. He created a system that paid bonuses for improved efficiency to its employees, based on wait times at each clinic. Promotions and evaluations also hinged on meeting organizational goals like reducing wait times to under 20 days. It was well known within the organization that filing a complaint about the organization was asking for trouble. Often this meant dismissal from their position or being berated and eventually terminated. The culture and ethics of the organization was spiraling downward, but very few dissented with the way the organization was run. Between 2011 and 2013, the Phoenix VA received over $10 million in bonuses. Schedulers at the VA were encouraged to record misleading data to ensure bonuses continued. When Dr. Foote retired as an ER physician in December of 2013, he became a whistleblower. He was outraged by the actual wait times at the Phoenix VA, and he had knowledge of veterans who had died while waiting months for care. He was joined by others who had filed claims against the VA and had been wrongfully terminated, which resulted in other whistleblowers coming forward as well. Dr. Foote's claims went ignored until April of 2014, when CNN did an extensive report on his allegations. The allegations were getting the attention of the national media and of veteran organizations as well. In May of 2014, Secretary Shinseki placed the top VA executive on suspension until an IG investigation was completed. Also during this time, Secretary Shinseki called for a records audit of several facilities within the Department of Veterans Affairs. Upon completion of the investigation, the IG reported widespread manipulation and mismanagement of records at the Phoenix VA. It was identified that wait times were being recorded as 24 days, while actual wait times were 4 months. Approximately 1,700 new veterans were not in the scheduling system and had no appointments. The investigation was then opened to include more than 40 facilities, and more personnel were suspended. It was identified that 80 veterans had died waiting for care in the VA health system, which triggered criminal investigations all over the country. On May 30, 2014, Secretary Shinseki resigned amid mismanagement allegations and a system in turmoil. April 2014. Multiple whistleblowers in the Phoenix VA healthcare system stepped forward with allegations of 2 separate waiting lists, the public electronic list and an offline secret list. This 2-list system enabled falsifying the electronic results to keep the wait times within VA acceptable guidelines. As many as 40 veterans or more may have died while waiting to receive care. May 2, 2014. 2 Phoenix VA employees are motivated to secure documents, alleging that there was a systemic effort underway at the hospital to shred documents to eliminate evidence of the waitlist cover-up. This map identifies many different areas of concern. It shows that the problems identified within the Phoenix VA were not isolated events. In Fort Collins, Colorado, Austin, Texas, and San Antonio, Texas, employees were directed to manipulate the books to conceal evidence of lengthy wait times for appointments. In Columbia, South Carolina, 6 deaths were linked to delayed screenings. And in Charleston, West Virginia, a doctor claims she was directed to put patients seeking treatment off for months on end, and at least 2 of them committed suicide. Phoenix VA by the numbers. 1,400 Phoenix VA patients included on the electronic wait list, but no primary care appointment scheduled. 1,700 Phoenix VA patients never entered into the electronic wait list. 1,100 newly enrolled patients in the Phoenix New Enrollee Appointment Request Tracking Report who requested a primary care appointment. As of April 28, 2014, these patients were not included on the electronic wait list and did not have appointments. 200 Phoenix VA patients who, as of April 2014, were not included on the electronic wait list and did not have appointments after being given a schedule an appointment consult from emergency department physicians, inpatient services, or mental health providers. $9,345 the bonuses received in 2013 by the Phoenix VA director for a highly successful rating, which included significant improvement in removing some of the access concerns, the long waits, and moving to the electronic wait list. In addition to the preventable patient deaths, there are construction and resource allocations concerns as well. The American Legion has voiced concerns over many mismanagement issues in Orlando, New Orleans, Denver, and Las Vegas. There was massive mismanagement of construction contracts, which resulted in 4 major projects being over budget by $1.5 billion and being delayed on an average of 36 months. Once completed, the Las Vegas hospital lacked an ambulance bay for their emergency room, which required an additional $16 million in funding to repair the grievous oversight. In Hot Springs, South Dakota, the American Legion supports local veteran protests against the shutdown of a VA medical facility, which would require patients in rural areas to travel to a distant facility for care. To get an idea of just how big of an impact the Veterans Affairs scandal was, there must be an understanding of how incredibly robust the Veterans Health Administration is. Established in 1930, the VA consisted of just 45 hospitals with an operating budget of $786 million. Today, it is the nation's largest integrated healthcare system with a $163.9 billion budget. As of 2014, it is estimated the entire system provides care in some capacity to 9.3 million veterans at approximately 1,700 locations. Due to the complicated federal hiring processes, VA treatment facilities have had a chronic shortage of personnel. The underlying issue of access to care incentives based on meeting access to care milestones would be the ultimate undoing of the VA healthcare model. In healthcare organizations, access to care is very important and is quantified by how fast a patient can be seen by a provider. In order to meet the standard, the VA instituted a reward system for managers who met certain milestones for access to care, which was 14 days. In 2005, it was reported that schedulers were not adequately trained to perform their duties, and they relied heavily on the managers to fix the problems with scheduling. Managers then failed to give guidance on how to fix the wait times and did not properly report the problems. Managers feared that they would lose monetary rewards for not exceeding the access to care standards. Wait times worsened and schedulers began gaming the system to give an appearance of meeting the standards. Schedulers would find an open appointment in the system beyond the 14-day performance standard, ask the veteran if that later appointment would be acceptable, then enter it as the veteran's desired date of care, which made the wait time of an established patient 0 days. If the patient agreed to the appointments, then the appointment was booked as if the veteran requested that day, when in fact this was not the case. The Phoenix healthcare system was involved in a probe that was investigating scheduling practices and became the hotbed for a much larger problem that is still in the process of being fixed to this day. In Phoenix, it was discovered that approximately 1,700 patients were on a secret waiting list that was kept separately from what was being tracked in the scheduling system. After the atrocities in Phoenix were uncovered, another 42 VA facilities were put under investigation for suspicion of having similar scheduling practices. Results of a separate audit of 216 VA sites, including 138 medical centers and large community-based outpatient clinics, concluded that a systemic lack of integrity exists within some VA facilities. Overall, schedulers at 64% of the VA facilities said they were instructed to alter dates and in some cases were pressured into making wait times appear more favorably. Before resigning from his position, Secretary Shinseki tried to help to identify the 1,700 patients from the Phoenix VA hospital and get them seen by doctors in a timely manner, and he also ended the awards program. Now the VA is under new leadership, and there is still a lot of work to be done to change how the VA is viewed and to regain the trust of those seeking care within its organizational umbrella. The organization as a whole needs to complete regular ethics training. The training needs to be done at all levels, from the largest hospitals to the smallest clinics, because management at many levels were aware of the problems and chose to ignore them. It was common knowledge that employees within the organization who filed complaints against their leadership were subjected to retaliation. If there are not consequences for wrongdoing and management does not stand against unethical practices, then employees will only follow suit. Safeguards need to be implemented for everyone who files complaints about their superiors. With ethical issues this rampant, the best choice is often to bring in new management who have demonstrated their capability to make tough ethical decisions. Additionally, a survey needs to be conducted anonymously and regularly to ensure that personnel are acting ethically and standing up when they see unethical practices. These surveys, once conducted, need to be analyzed and adjustments made within an immediate time period. A hard line must be taken on unethical behavior going forward to reestablish an ethical and respected organization. Bonus incentives pushed a culture of competitiveness in an organization that did not need it. The culture should focus on cooperation as well as the healthcare of veterans. Those who contribute negatively to team culture and behave unethically need to be removed from the organization. Those who retaliate against those filing claims need to be fired. Employees cannot be allowed to intimidate or extort employees or patients. Once employees feel empowered to notify ethics committees and boards that members are not acting according to protocols and laws, then the culture can change for the better. When defining success in a healthcare organization, one must take into account many variables. Questions such as, are we adhering to nationally recognized standards, and is our leadership and staff embodying the values of the organization, often arise. When the leaders of an organization seek to establish a culture of ethical leadership, they are attempting to either create or sustain an environment where all members feel empowered and motivated to meet the needs of the customers or patients. Within the Veterans Administration, this was not the case. Team members at the bottom of the organization did not feel as though they had the authority to report known issues. The VA failed at almost all of the 7 functions of cultural leadership. Only by addressing the failures will the administration be able to make a turn for the better. The leadership should start communicating to their employees at all levels to ensure that they understand the goals of the organization and also where they stand in meeting them. This can be accomplished by allowing staff members to submit findings anonymously and the leadership addressing them publicly. Transparency can go a long way in proving that the leadership is interested in improving identified issues. The ethical issues that became widespread amongst all departments within the VA could only be adequately addressed by bringing in new leadership. A more robust program that addresses developing and sustaining new leaders from within the organization should be implemented. There should also be assessments conducted on a regular basis to gauge how they are developing. This also helps to track and ensure the up-and-coming leaders are aware of previous issues and also ensures they do not fall into the same loop of repeating the same mistakes. In the end, the steps the VA took in response to the issues that led to the scandal did little to ease the distrust of the public. The failure started when leaders failed to reinforce what the mission was, which is taking care of their customers rather than inflating numbers or creating secret lists to gain rewards. Leaders failed to listen to associates that had insight into what was happening on the ground. Leaders remained aloof and did not model the organization's values and did not train staff on how to properly follow protocols that govern appointment scheduling. Simply put, if the VA had adhered to the functions associated with an excellent healthcare organization, the likelihood of an issue or scandal of this nature occurring could have been greatly reduced.
This presentation covered an abstract of the situation, a synopsis of the scandal, an overview of the issues leading to the scandal, how to overcome adversity, and defining success in the future.